Healthcare workers have become some of the most essential folks during this pandemic, and even more are needed. UAB medical professor Dr. Reagan Durant joins us tonight to talk more about recruiting black students for medical school. Thank you so much for your time this evening.
Glad to be here.
So the COVID-19 virus has significantly exposed healthcare deficiencies in the black community. One of the issues that's come up is the black community's distrust of the healthcare system. I'm sure there are a lot of reasons why that is. Why do you think that is?
So I think the distrust is actually probably emblematic of broader distrust in the healthcare system. And in truth, much of the information that has been disseminated relative to COVID-19 and the pandemic. I think what we see in the African American community is that oftentimes it's a canary in the coal mine, so that distrust may be even more intense and specific to African Americans is probably due to a legacy of discrimination, legacy of abuse in medicine and research. And I think all of those things combine to lead to a heightened level of suspicion.
In the area of doctor diversity, 13% of the total population is black, but only 5% of doctors are African American. Why do you feel that number isn't higher?
So one of the difficulties and challenges in increasing the number of African Americans in the physician workforce is just the pathway. So you have to start off with an adequate number of people applying for medical school, finishing medical school, and then, of course, pursuing careers in medicine. And the number of applicants is disproportionately small. So the key really is increasing the number of applicants so that more people may enroll and ultimately become physicians.
How does seeing someone like you in the white coat in your doctor's office affect overall health care?
So, it potentially has a variety of effects. And these are, in some respects, generalizations. However, there are often times when I walk in to a patient's room who's never met me before, and it's an African American patient, and there is at times a look of surprise and a pleasant surprise. I think that it is comforting for some African Americans because of a presumption of a shared background and cultural framework. And so on the whole, I think it can be reassuring. That is not to say that in those instances where an African American patient is seen by someone of another race, that provider can't be just as reassuring or connect with that patient in an effective manner. But there is a shared connection oftentimes when an African American patient sees an African American physician.
And in your recruiting efforts, what issues are you finding? What roadblocks are you coming across to bring more African Americans to the business of doctoring?
So I think that there are a number of challenges. I think one of them is just role models. And then, of course, it becomes sort of a chicken and egg sort of phenomenon, namely that there are too few African American physicians currently, and that results in fewer role models for young students who might be interested in medicine, and therefore fewer of them choose a career in medicine. I think there are also some very real structural barriers in that medical education, as well as, quite frankly, all higher education at this point, is very expensive. It costs about $240,000 to get a medical degree these days. And so if you have a group of people like African Americans who are disproportionately poor, it doesn't mean all African Americans are poor, but more of them are poor, that just may seem like a daunting number in terms of what can be allocated and what's available to invest in education. There's statistics that show that African Americans are also more likely to fall in the highest category of debt owed following undergraduate education. So all of these things, I think, combine the absence of role models, the money needed to receive a medical education, and quite frankly, the time invested. You're talking about undergrad, medical school, and then residency training. So all of those things combine to be challenges to recruiting African Americans into the field.
Dr. Reagan Durant, thank you so much for your time and expertise.
Thank you.